Plaster therapy allows us to obtain quick and definitive results on the tissues. Thanks to its occlusive and reshaping action, these results are visible from the first session. From the first treatment, we obtain a reduction in volume and isolation of the fatty tissue. This treatment is ideal for anyone looking for a quick and localized loss of fat. Initially, there will be 2 weekly treatments, and then a monthly treatment to maintain the results obtained. Due to the intense reshaping action of the wrap, it is important to adapt the application method according to the area being treated, in order to optimize the results of the plaster therapy. The plaster therapy treatment can be applied to different areas, such as the arms, breasts, abdomen, buttocks, and legs. In this video, we will show you a full tummy treatment. The duration of the full treatment is 1 hour 15 minutes. Prepare the skin with a gentle exfoliation using double body peel. Apply the product with circular movements and remove it in the shower or dampened mittens. Apply the concentrated cellulite control over the area to be treated. With a gentle massage until it is totally absorbed. We then apply a small amount of thermoactive cream on the areas with the greatest problem of accumulated fats. Due to the hyperemia that this product causes, the burning of the fat is accelerated. Apply using kneading movements. We then apply 50 milliliters of exudation cream on the area to be treated, to protect the skin from the mask we will apply next, in order to intensify its occlusive action. Spread uniformly through kneading movements. After the cream, cover all the area to be treated with the gauze. Apply one of the gauzes covering the abdomen, the sides and the back part, and then place the next gauze in the opposite direction, which means starting with the lumbar region covering the sides and ending with the abdomen, ensuring that it is as tight as possible. In a medium-sized bowl, mix a sachet of 440 grams of SCULPT plaster with 210 to 230 milliliters of water, according to the area to be treated, and mix with force until obtaining a uniform mixture. Immediately apply to the area to be treated directly with a gloved hand. Apply SCULPT plaster on the back and sides. Help the client to lie down and proceed with the application on the abdomen. To intensify the reduction and shaping action, ask the client to tense their abdominal muscles until the wrap completely solidifies. For a more satisfactory result, it is important that during the application and the first minutes of placement of the mask, the client maintains their muscles slightly contracted. This way, we boost the reshaping effect. It is important to cover the area treated with plastic in order to maintain the temperature, intensify its action, and so that the placement is much more pleasant. Leave in position for 30 minutes. To remove the wrap, we must cut it using blunt scissors and then separate it carefully from the skin. With some mittens, remove the product left on the skin and end by applying Slim Effect gel until totally absorbed. We will now see the application of the plaster on other areas to be treated. Legs. Cover each leg with the gauze, wrapping it around completely and tightening the fabric so that it is fully in contact with the skin. Then apply the plaster on the back part, asking the client to bend their leg. Continue with the application of SCULPT plaster in the lower part, ensuring that it is well sealed all around. Ask the client to tense their muscles until the plaster has completely solidified. Buttocks, saddlebags and back of the legs. Place the client in the prone decubitus position. Now with the skin prepared, protect the area with the gauzes. To do this, fold the gauze in half and apply it, adjusting it over the area of the buttock, saddlebag or rear of the leg. Repeat the process on the other side. And ask the client to tense their muscles while the plaster solidifies. Arms. On treating a smaller area, 1 sachet of SCULPT plaster is enough for 2 sessions. Cut the gauze in 2, fold it in half and cover the upper part of the arm with it. In this case, to tense the muscles, the client should join their hands over their chest and press them together. Hold this position until the plaster has completely solidified. Breast. Due to the sensitivity of the area, avoid the application of thermoactive cream. For greater safety, previously protect the area of the areola with a cotton disc. The placing of the gauzes on the breast must follow a specific procedure in order to boost the reshaping effect on the breasts to the maximum. To do this, fold one of the gauzes transversely and place it over the breast. Then, cut the second gauze into 2 longitudinal halves and use them to make a crossway attachment that raises each breast. To do this, place one of the halves beneath the breast, holding the end behind the back, tightening the gauze and crossing it, attaching it beneath the opposite shoulder. Repeat this process on the other breast, and then apply SCULPT plaster covering the whole area. As in the arms, ask the client to tense their pectoral muscle by joining their hands over their chest and pressing them together.